introduction to Dr. Rocker, who has guided us through this, who's going to give a couple of minutes of his recent experiences and insights, take a couple of questions, and then I have a few words to our community before we move on. Dr. Rocker, I think you're here. Thank you very much, Josh.
Hi, hello everyone. Hope everyone is well. And again, thank you to everyone for joining in. And Dr. Santos, that was absolutely amazing. So thank you so much. I will definitely bring your words of wisdom and your insight to the teams in the hospital. Updates from the hospital. There's some good news, and the good news is that all the actions that people have been doing in regards to social distancing, in regards to staying in their homes, has paid off. So we are still seeing an increase. We are still seeing more patients come in every day, but what has changed is the slope isn't straight like this anymore. It's turning a little bit, which means that we're starting to get towards the peak, and people have suggested that potentially the peak will be anywhere in 10 to 14 days, and we are seeing evidence of that, and that makes a huge difference from a hospital perspective. So I don't want people to think like, woohoo, like we're done. No, every day there's still more patients. I think when we started talking, there were maybe 30 admitted patients in a hospital. Right now, the hospital that the adult hospital I'm most closely associated with, and Dr. Lisker is associated with, is LIJ, and we have 450 COVID positive patients there. That is taking up around 85% of the space of the hospital. That's not including all the people who require surgeries or giving birth. So it is stressing the system significantly. The Children's Hospital has given 50% of our space to LIJ because their space can't handle the number of patients, and the patients are still coming. But the good news is everything that you guys are doing, that stressful, thing of staying indoors, is making a difference, because we are seeing the flattening of the curve. We are seeing that spike isn't going straight up anymore. The spike is, starting to curve, and that is an enormous benefit. So thank you to everyone. So I still want to reiterate the same things that we have said before, is because it has worked, we want it to continue to work. And we want people to continue to practice the same things that they were practicing before. And the main things are washing hands, social distancing, and really the best you can, staying inside, minimizing your exposure to others, and really planning out your week. So if you have to go out and get things, kind of consolidating it into as few trips as possible. And when you go out, try to stock up. If you're shopping, not for a few days, but for a week or 2 weeks, so you don't have to go out much. So there were questions that people sent, and I'd like to address some of those. One of the questions was about masks. Do I need a mask? What's the benefit of a mask? So the benefit of the mask is a fewfold. As we've discussed before, this is a respiratory droplet infection, and we know that when someone coughs or sneezes, so let's say you have a mask and you are healthy, you do not have it. When you walk out, if someone coughs or sneezes, it's not going to go near your mouth, it's not going to go near your nose. It may go near your eyes. So does it protect you from that? To a certain extent. But what it does do for someone who isn't sick is it kind of prevents you from touching your face, right? You may touch your mask, but if you're touching doorknobs, you're touching other things, you aren't introducing it to your nose or your mouth. And so that's important. Now, for those who are sick or those who are shedding the virus, and you may be shedding the virus and not feel sick, and that's the confusing part, right? So someone who is about to get sick in 2 days, or someone who has it and has the virus in their secretions, in their saliva, in some of their, in their boogers in their nose, the runny nose, they may not feel sick. And by wearing a mask, if they cough, if they sneeze, then it's not spreading all over. So the benefit to you who is healthy is that it sort of prevents you from touching. And if there's direct contact from someone else's spit or sneezing, or coughing. And for someone who is sick or maybe shedding and not even know it. So it does have some benefit to those on the crowd. I know we discussed in the past, it doesn't have much of a benefit. And I think we're learning it probably does have a little bit more of a benefit than we thought. How long is this going to last? I don't exactly know, but the whole concept, and if people looked earlier back, when we talked about flattening the curve, if we didn't flatten the curve, it would have been a much higher spike, and then it would have been an equal, quick dive on the way down. If we flatten the curve appropriately, the curve will start, but then once you hit the peak, you're actually not at the 50% point yet. There's still going to be illness for a longer period of time. It's not equal on this side and on this side. So by people quarantining, that's great. And then the question is, well, can I stop self-quarantining once that goes down? Well, if you do, then it could just spike up again. So if people are saying, oh, we hit the peak in 10 days, does that mean, we're going to be able to stop self-quarantining at that point? I do not believe that is going to be the recommendations of the Department of Health or the governor or anyone else at that point. So I would, in regards to the question that was raised with Dr. Santos, the uncertainty of how long this is going to be, I would anticipate this to be several more weeks. If I am positive or likely positive, when can I return sort of into society? So remember, returning to society is really just returning into the recommendations of social distancing and still quarantining. But still, that's a real question, because if people are in isolation in their home and they're really minimizing the exposure to the other family members, people want to know, when can I sort of, hug my kid? And the answer that the Department of Health initially said was that we have to have 2 negative tests. No one's doing that anymore. And so what we're really saying is 3 days symptom-free from the time of the last symptom, knowing that the cough sometimes can linger a little bit longer. So if you're still having body aches, you're still having mild fevers, you can't start the 3-day count until you're really feeling much, much better and only have a little bit of a mild cough. People are asking about things coming into the homes. What do we do if I go shopping, if there's a delivery from Amazon, if someone is delivering food to our home? So what I would recommend is you could bring that into your home. You can, unpack it, put it away, wash your hands. Throw away all the baggage associated with it, and then wash your hands. And while you're doing it, be very thoughtful not to touch your face or anything like that. And ideally, if you could, whatever you just brought into your house, give it, a day or so before you go to it again, just because if there's any virus, on it, the best is to sort of let it be for a bit. However, the data shows it's not generally being spread that way. It's really more person-to-person contact is more the route of transference. If we get it, are we immune? The likelihood is yes. And then there were a lot of specific questions about medications and research. I'm not going to go into those here. A lot of that more is going to come out over time. Research is being done, but no definitive data is really being published yet. But there are studies done at multiple hospitals throughout the city. And then another question was about the elderly, what to do. I really feel the need to reach out to them because they're feeling enormous stress at this time. And figure out, what would best work for them. Again, we're still trying to practice social distancing, especially in a vulnerable population. The statistics most recently, I know from China, it was saying, oh, it's really, significant impact on the elderly. We're actually seeing, I could tell you from Northwell, with over 1,000 patients that we have reviewed, that 2/3 of the patients who are testing positive are under the age of 70. So it is not just the elderly that are getting it. It's really the whole swath of the population that is getting it. But we do know that the worst outcomes is definitely in the elderly. So it is one of those things that do the support that you can from a distance. But be as supportive as possible. Call, video chat, do whatever you can. If they live in an apartment complex near you, if you could visit, but maybe in the hallway, do something. minimize contact, because it still is a risk to that family. I think that was a lot of the questions that were sent. If there are other questions, Rabbi Krause, if you want to send my way, I'm happy to answer.
Thank you, as always, Dr. Rucker, and thank you to the whole medical team. I know that we talked about this before. I'm gonna throw it out there again because it's coming up again. Can we take walks outside? Should we take walks outside? How do we take walks outside? Can you give us 30 seconds of guidance on that?
Yeah. So in regards to going outside, highly recommended. I think, as Dr. Santos referred to, our mental health during this time is extremely important for our own sanity, but also for our wellness and for our immune system. And the outdoors, time and time again, has proven to be beneficial to us in so many ways. And it does have a way of boosting our parasympathetic and calming us. So the way to do it is, go in the group of your family or smaller. The social distancing that you do outside. So, we've talked about Germany and their recommendations. The social groups that should be getting together are you or the family unit. So if you want to go for a jog and smile at people. Everyone knows when you're running or you're walking on the street and you get a smile from someone else and, smile, that lifts the spirit. So I think it's important. It's not a time to sit and stop and chat. But everyone kind of knows when you give that smile and keep going, they're sending me good vibes. We don't need to have a full conversation about it. And you can certainly, call them later if you want to have a larger conversation. So going outside, going into the woods, going into nature, going into your backyard, highly recommended, but still practice social distancing the best, so just don't gather with other groups and, stay with your family or smaller.
As you heard, many people here, many of our kids are on week 5 of this, and the questions, this is not to call anybody out, this is really just to address it directly. People are asking about, small groups of kids getting together, what do you think about that? How do we talk about that? What, again, I know it's a hard question, and we just want to hear, again, a minute of your advice and guidance.
Yeah, so we are still in a crisis mode. Coming home from the hospital every day, it is not good in the hospitals. There's a lot of stress. There is overcrowding. We do have resources, but they are running thin. So whatever we do to minimize the risk to the community will pay the benefits. So we have seen a flattening of the curve, and that is because of all the hard work that all the individuals have done. And it's one of those things, it's nice to get the instant gratification of, I did something and I see the benefit. I'm telling you, the benefit is 100% there, and I'm extraordinarily appreciative, and the whole health system is extraordinarily appreciative to all the discomfort that people are experiencing. I would still say no gathering, no getting together. That's not what we should be doing right now.
Thank you again, Dr. Rocker. If you're missing the comments in the chat, people love you, and they're very, very appreciative of your weekly guidance and calm and positivity, and for all the work that you're doing out there. So thank you very, very much. I'd like to read, I'm going to read this verbatim. I got a call from Hatzalah yesterday, and I want to be very clear. Obviously, Hatzalah is here for our community. They are asking you to be aware of the following. They've gotten many calls. Chevra Hatzalah dispatchers have seen a tremendous increase in phone calls to our emergency dispatch center. Our members and dispatchers are stretched very thin. We have increased capacity at our dispatch centers. However, we need your help to limit the phone calls to emergency calls only. Our dispatchers cannot give general advice. For non-emergency coronavirus questions, please call your doctor. Hatzalah cannot advise you about testing sites, quarantine questions, or other general coronavirus information. If you think that you have symptoms of coronavirus but do not require immediate transport to the hospital, call your doctor for advice. Call Hatzalah only if you have a medical emergency. While Hatzalah is always careful not to discourage anyone from calling, and the same is true now, we ask you to please act responsibly and not tie up our lines with general questions. We're, of course, grateful for all of the work of Hatzalah and agreed to put this out. I spoke to Jeff Merdler, who's a member of Hatzalah, one of the many members of our community, made it clear again, if you have any possibility, suffix, doubt of an emergency, you should call Hatzalah. But if it's not, then please go to other avenues, including our hotline if there are general questions that we might be able to answer, and it's not an immediate medical emergency. We are not going to have our regular town hall next Monday night. We're hoping to do something a little bit different pre-Pesach, and we'll send some more information about that as it gets closer. For SAR Academy parents, we're going to have some department town halls later this week and right after we get back from Pesach. So for ELC, for lower school and for middle school, just to give you some more kind of department-specific updates, responses to your feedback, and taking some of your questions. So please look out for the calendar for that. We've also tried to put out studies that we think are beneficial to the community in general, and please note those studies. There's something going on tomorrow that they're looking for volunteers or for people from our community to be part of. So please look out for that. And if you can, that's again one of the wonderful things that you can do to help fight this virus. I want to thank all of our volunteers, the chesed opportunities and the chesed that's being done quietly and modestly by members of our community is really inspirational. And if there are people in need, if you're aware of people in need, please, please, please let us know. It's Yom Tov is coming, and it's a lot. There's a lot there, and there's a lot of stress there. In addition to the regular stress, of course, this year, we want to be responsive. We want to make sure that we take care of people. And if you know of anybody in need, please do let us know about that. I want to take this opportunity to thank everybody for all the work that they do, to thank all of you for being part of this incredible community. And we look forward to seeing you soon. In person soon, and sooner virtually through many of the community events, shiurim, and activities that are taking place. Thank you all. Laila Tov. Have a great night.